Because in general, prevention is better than cure. So the earlier we can pick up potential complications, the better chance we have of heading them off or slowing them down. Okay. So what we thought would be helpful would be if I just went through tests that you might have. You won't all be having all of these tests. Some of you may have had several already. But these are the sort of things that we may arrange from clinic. And I just want to briefly go through what they are, where they happen, and why we do them. Okay. So the first one, I've opted to start from the top and come down, if you like, are tests of cognition, by which we mean your ability to think clearly, to process information, your memory. Okay? Many of you who've attended clinic may well have gone through questionnaires where we ask you ridiculous questions and you all grimace and go, oh no, he's doing it again. But the importance of this is, again, it's something that can occur without people really being fully aware of it. And we need these sort of tests, which we do in the clinic as a rule, to try and help monitor the situation, not only to see if it's there full stop, but also to take a baseline so that in the future we can see if things have changed and whether, in fact, we need to investigate that in another way. Because mitochondrial disease is not the only condition that might cause those problems. Thyroid disease, which is very common, could cause those problems. And because we see you on a regular basis, we're in as good a position to look for other conditions as anybody else is. And it's important for us to look at the bigger picture as well. So, what other tests might you have? We might arrange an audiogram, which is a hearing test, essentially. That will usually be done in the ENT department at the Freeman Hospital. These are all Newcastle hospitals. And the reason, as I touched on before, is that nerve deafness can go unnoticed, and it can cause an awful lot of problems in general life, at work, in home life, and especially, again, perhaps in children in the school setting. The hearing aids that are available these days are very, very good. They're generally digital, they're very unobtrusive, and they work very well. And even in patients who have very severe deafness, there is also something called a cochlear implant, okay, which even when hearing aids are struggling to do the job, these can restore hearing to a reasonable level. So there's lots that we can do if we detect problems with hearing. Ophthalmology assessments. So essentially, people always think this is just an eye test. It's not like the eye test you might have at Boots. You do get that, but what we have is a consultant ophthalmologist who will look at whatever the problems might be. And it's not just the vision, which might be due to a problem of the optic nerve, or the retina, or cataracts, but we also look at the eye as a whole, because many patients, as I said before, may have drooping of the eyelids, which can be quite disabling. Sometimes, even if it's not affecting vision, patients would much prefer that to be corrected, if at all possible, just for the aesthetic purposes, for the appearance. And that's a personal choice, but it's something that we can do. We tend to use the same ophthalmologists here, and Phil Griffiths, one of our consultant ophthalmologists, has talked for us before. And it's like anything else. The more experience you have of a particular condition, as a rule, the better at it you become. So it's very helpful that we have the same group of staff in ophthalmology seeing all of our patients with mitochondrial disease. Speech, language, and swallowing assessments are very important. I'm not going to go into any detail on this really, because Sue Clark's very kindly going to speak after me about this. But we can screen for this in the clinic. Patients may have to attend the speech and language therapy department specifically for further tests. But the reason we look for it is because muscle weakness can sometimes affect the muscles around the throat, which can affect the swallowing and the speech, and sometimes patients who have very bad balance problems. What people don't realise is that all of the movements within the mouth are extremely complicated and have to be coordinated. And if your coordination is very bad in the limbs, it's very often the case that it's bad up around the mouth as well. So the speech may become slurred, and sometimes swallowing can be a problem. Spirometry are breathing tests. Many of you have had this. It's a very straightforward thing we can do in the clinic. It's basically a handheld machine. You take a big deep breath and you blow and you blow and you blow as hard as you can. We generally stop you blowing before you turn blue, okay? But then we can read out exactly how much you've managed to blow out, and it gives us a very good measure of how strong the respiratory muscles are. And again, that's important to check on because it's something that can cause problems if it goes unnoticed, but it's quite easy to detect. Another thing we do is something called overnight oximetry. That's very straightforward, essentially just a probe on the finger overnight, and it tests to see if the oxygen levels stay right up where they should be, or if they run a bit low throughout the entirety of the night, or if occasionally, as your husband next to you, okay, which I suspect rings bells with a few people in the audience, whether there might be a problem with what we call obstructive sleep apnea, where just for a second or two the oxygen can dip right down. It's not really, as a rule, a dangerous situation, but what it does do is it wakes people up in the night without them being truly awake to remember it, and they feel awful the next morning and can feel fatigued and tired and worn out and never quite know why. So that's just a picture of the finger probe, and it's as straightforward as that. So an ECG, which is a heart trace, you'll have seen this on Casualty and everywhere else, I'm sure. We can do that direct from clinic. We send you along to the cardiology department, which is quite close to us now, which makes things a little bit easier. The reason we do that is mainly to look for rhythm problems of the heart, either running fast or more commonly slowly. There are certain mitochondrial conditions where patients are prone to the heart running very slowly. Okay? In some patients, so slowly that they would actually need a pacemaker to be put in to prevent it going so slow that it stops at some point in the future. Now, that's an unusual situation, and these days very few patients come to us where this hasn't already been looked at. So I don't want to be stood here worrying people about that, but this is why we check for these things. It might also indicate that the wall of the heart might have become thicker than it would normally be, which might indicate the need for an echo, which is our abbreviation for an echocardiogram. This is just the ECG. It's basically some sticky electrodes onto the chest that measure the electrical activity. No electricity goes the other way, okay? Just measures. So it just gives you a readout of the heart rhythm. The echocardiogram, again, will normally done in the cardiology department, either at the Royal Victoria Infirmary or at the Freeman Hospital. And this helps us to look for heart strain, okay? In some mitochondrial disorders over many, many years, sometimes there can be an extra demand on the heart that might make the muscle wall thicker than it should be, which can cause problems. And we can detect that with an echocardiogram, and there are pharmaceutical treatments, drugs, which we can give to try and prevent that. And like most of these things, the earlier we know about it, the more likely our chances are of preventing that from progressing. This is just a picture really of what the echocardiogram is. It's really, for any women in the audience, it's just like the ultrasound probe that they use when you're pregnant. They just put it a little bit higher. This is a lady there just looking at this young chap with the probe. That just shows what everything is. Those are the atria, the top of the heart. These are the big ventricles at the bottom. And this is just showing you how you can see it moving. This is the valve, and the blood comes through there. Okay. The other thing we sometimes do is something called an EEG, which stands for electroencephalogram. And that's essentially a brainwave test. We will do that the neurophysiology department. We currently have one at the Newcastle General as well as the RV.